Good morning, good afternoon, good evening, wherever you're watching for. We remain Dr. Doni TV. Today we're going to talk about what happened in labor ward during delivery or after delivery. You know nowadays a lot of people after delivery they start bleeding and so on so profusely. Some of them even lose their life because there is no means to, there are no proper, way to control this bleeding. And again, even when doctors are trying to do their best. And again, please, I want to encourage us. We should stop going to all these quackeries, all these quack people who go to, who want to, take delivery because they have watched one or two things and they want to start taking delivery. And I want to tell you, after delivery, there are a lot of complications that arises, such as what they call postpartum hemorrhage. Postpartum hemorrhage is a deadly stuff, after delivery, and this thing can be averted if you go to experienced place where you can gain knowledge, place where you have experienced doctor, experienced nurses, experienced midwives, and so on. Okay, now after delivery, yes, quite all right, some people can have what they call uterine atoning when the uterus is very soft. Okay, it's very soft. Normally after delivery, the uterus is actually meant to be contracted, so that if there are going to be bleeding, that will not happen. Okay, and again, there are other cases where people can have postpartum hemorrhage, such as when people have cervical laceration. And yes, cervical laceration can actually occur when the patient in quote does not adhere to the instruction of the nurses or the doctors. Most of them are not fully dilated, the cervix are still hovering the head of the baby is not fully engaged, and they start pushing, and that can cause a tear in the cervix, which can result to bleeding, and this should be given an urgent attention. Immediate repair should be done so that it doesn't cause so that patient cannot go into shock and so on. And when these people lose a lot of blood, you have no choice to transfuse them, because you must transfuse because they've lost a lot. If not, next thing that can happen is that they go into shock, and that will be very, very, a serious issue. Again, people who have had multiple deliveries. So in Nigeria, we should learn to born less, at least 2, 3. It's okay. Why going to 4? Why going to 5? Okay, because when you tendency of you delivering more will result to you to bleed more in the non-subsequent pregnancies. Okay, please, we should also try to make sure we contact go to a facility where you have people, doctors, midwives, and so on, the experienced nurses. Stop going to all these TBA, traditional birth attendants. Stop going to those quacks in town. These people have caused a lot of rate of maternal mortality in our environment. Okay, there are a lot of hospitals within that you have experienced people. Okay, so we should try as much as possible to avert this. Again, cervical tear, perineal tear can also cause postpartum hemorrhage. Okay, when maybe after delivery there is a slight tear, maybe due to the weight of the baby is too big, and when it's coming out, there's not enough perineal laceration, which can also be repaired by a doctor, by experienced doctor that are on call. Okay, so we want to thank you that this time we're going to be telling you more about things. When you are in labor room, you don't need to panic. There are people, but most importantly, make sure you go to place where you have experienced midwives and experienced doctors, qualified doctors. You will get the best. Okay, don't panic when you want to have your safe delivery. Thank you very much. Remain blessed. We remain Dr. Doni TV. Love you. Ciao.